We just heard from Dr. Palmer in his analysis of the Saratoga situation. Delmar has similar circumstances to Saratoga. Delmar is a state fair, grounds, and the most popular fair in the state, the San Diego County Fair, ends on July 4th, just a short time before Delmar starts. Delmar Turf Club has only a few days to get the track ready for the racehorses. That includes preparing the track and the stable area. Delmar gave up a week of racing in 2017 to allow the TrackMan an additional week to prepare the racetrack. Similarly at Saratoga, there is pressure to run at Delmar. The California Horse Racing Board, after the 2016 meet, interviewed trainers, veterinarians, jockeys, and owners. And the trainers, jockeys, and owners all felt pressure to run at Delmar. The owners, on the other hand, denied putting any pressure on the trainers to race at Delmar. But the perception is that, and the reality is, everyone wants to race at Delmar on the West Coast as much as they do at Saratoga on the East Coast. The title of this talk is Identifying Horses at Risk. For an overview of this issue, I encourage everyone to go to the Jockey Club Welfare and Safety Summit presentations by Tim Parkins and others. They are available on the Jockey Club website under Advocacy and Promotion, and just follow the links to the presentations from past Welfare and Safety Summits. Dr. Parkins' presentations are easy to find. This slide is one of Dr. Parkins' presentations showing the increased risk of a catastrophic musculoskeletal injury with major drops in claiming price. This is certainly intuitive to most of us, but it's actually documented in Dr. Parkins' analysis. Similarly, in this slide from Dr. Sue Stover's work at UC Davis with the CHRB necropsy program, comparing training patterns with horses with the number one cause of equine fatalities, that's proximal sesamoid bone fractures, with horses that die of other causes. The upper red lines clearly show that proximal sesamoid fracture trained horses are trained harder than horses with other injury. But let's be clear what increased injury means. We should all be familiar with the concept because we read about one increased risk or another all the time. If you smoke tobacco, you have an increased risk of lung cancer. If you're overweight, don't exercise, and have high blood pressure, you have an increased risk of a stroke. If you have a history of breast cancer in your family, you are at greater risk to have breast cancer. It doesn't mean you're going to have lung cancer. It doesn't mean you're going to have a stroke. It doesn't mean you're going to have breast cancer. But what it does mean is your physician will take those into consideration when they examine you for routine health purposes. We want to do the same thing with our examining veterinarians. This is another slide from one of Dr. Parkins' presentations at the Welfare and Safety Summit demonstrating the concept. This horse has relatively few risk factors. On the other hand, this horse checks a lot of those boxes. What we are really trying to do is allocate our limited resources, specifically examining vet time, where it is most useful and most productive. This is a study that was conducted by Dr. Mary Scalay when she was in Florida. And what it compares are the interval between next races for horses that were subject to vet scratches based on examinations and findings, and compare those to cohorts or controls. And what it clearly shows is that those horses identified by the examining veterinarians as necessitating a vet scratch those horses don't run back for 2.5 times as much time as the average horse runs back, which is about 40 days. And that's very similar to California, by the way. What this shows, in spite of complaining from trainers, is that the examining veterinarians usually get it right. The surprising thing are the number of horses that race and then don't race again, which suggests that we are not identifying a lot of the horses that have musculoskeletal conditions. This is a slide that's was a joint project several years ago with Kentucky and California. At the time the examining veterinarian examined the horses, they drew blood to try to determine what the non-steroidal anti-inflammatory levels are. And as you can see, well, nearly 2/3 of the horses had phenylbutazone over 2 micrograms per ml. That's roughly what is considered to be the therapeutic threshold for phenylbutazone. And this doesn't include 7 samples with flunexin well in excess of regulatory thresholds. This is a case, obviously a fatality, where the horse had 4 corticosteroid injections and 2 non-steroidal anti-inflammatory injections within 72 hours of racing, all legally, and was declared sound by the CHRB examining veterinarian. It's for examples like this is why the examining veterinarians have pushed for lower non-steroidal anti-inflammatory levels and for greater restrictions on corticosteroids. No private attending veterinarian wants to do a pre-purchase exam on a horse that's been injected with corticosteroids and has high levels of non-steroidal anti-inflammatories. The way we identify unsoundness in horses is by signs of inflammation. Our patients, our horses, don't talk to us. We have to look for clinical signs, and if they're hidden by medication, then we're defeating the purpose of the pre-race examination. We've taken other initiatives, such as the voiding of claim rule, which has had a major impact on the way horses are managed in those jurisdictions that have established such regulations. This is some data prior and after the voiding a claim rule. And in the first top paragraph, you'll see that 15% of the horses that were claimed never raced again in California prior to the voiding a claim rule. After the rule was established, less than 4% never raced again, indicating that the management of claiming horses has definitely changed. In fact, I had one very well-respected practitioner tell me that of all the actions that California Horse Racing Board has taken in the last 10 years, the voiding a claim rule has made the most profound effect on the way horses are managed. With all the efforts we've made in terms of looking after racing situations, pre-race examinations, more restrictive medications, what we've seen in California, and particularly on the Southern California circuit, where it is much more competitive, is that the percentage of racing fatalities relative to training fatalities has dropped precipitously. It used to be 60% racing, 40% training. And what we're seeing now, and at least this data in Southern California since July 1st, which is a little over 21 months, we see a much higher percentage of training fatalities. To this end, we monitor our fatalities quite carefully, trying to identify those factors that we think are important. And what we've come up with are 2 groups that we think bear particular attention, and those are 4-year-olds and up who have not started, and horses that have been unraced for over 120 days. These are risk factors in both racing and training. Working with Encompass, I get a printout every morning that gives me the name, age, sex, color, the trainer, the ship-in date, and the date and time of the last 2 most recent works. This comes in a file that allows me to export it and save it as an Excel file. You really can't see much here, but this just is an example of an Excel file that has been modified. I can sort it by trainer, by ship-in date, alphabetically, whatever way that I want to be able to direct veterinarians to examine certain horses on prior to being entered. Similarly, we look at horses that have not raced for 120 days. Same sort of data. Also include any vets list history on this particular group. And again, this can be exported as a Excel file and sorted in any particular way that you want to take a look at. Now, what we do with these lists is we identify horses that we want to examine prior to entry. The last thing we want to do is walk in on a horse that hasn't started in 18 months, that we haven't seen, and determine whether that horse is fit to run. What we want to do is get a history on these horses, get an examination, know where they're at in the current time, so that we're in better position to make a decision whether those horses are fit to run or not, or in some instances whether they're fit to train. We also look at horses that are entered that we want to look at prior to race day for the very same reasons. If we have a horse that hasn't started on our track and our examining veterinarians have no experience with that horse, we want to look at that horse prior to race day. If we have suspicious drops, if there's no work in the previous 21 days, and believe me, on the Southern California thoroughbred circuit, these horses are trained very hard. Second or third start after a layoff is a high-risk start. Horses with ongoing exam concerns or any other PP or other history that gives us pause are slated for examination prior to race day. I want to give a plug to the Encompass pre-race exam module. It is a program that is very useful. It is something that we need to improve and make more user-friendly, but it's a very important tool for every racing jurisdiction. This is an example of just a tablet screen, and for comparison, this is more typically what we see. It may be useful for the individual writing it, but it certainly isn't sharing between tracks and examining veterinarians. Here's another example. This one actually has quite a bit of information, except if you can't read the writing, you're lost. And this is the exact same information from the previous card, but in a legible format in the Encompass system. So I encourage all racing jurisdictions to use the Encompass system, which allows all of us to share the data. And you should share your examinations with when a horse moves from track to track. It's certainly important for the health and safety of the horse. It is very well documented that 85 to 90% of all fatal musculoskeletal injuries have evidence of pre-existing pathology at the site of their fatal injury. That means that there is an opportunity to intervene, and these are potentially preventable injuries. To be clear, and this is often misunderstood when I quote this data, not all of the pre-existing injury that we can identify in the laboratory at necropsy can be seen clinically. but much can, and we are missing those. And by we, I'm talking about the examining veterinarian, the trainer, the attending veterinarian, and jockey. Let me give you an example from the CHRB necropsy program. This is a paper from Dr. Stover's laboratory discussing 12 metacarpal fractures in horses. And what we're talking about here are diaphyseal fractures. Those are the fractures in the main part of the bone that don't include either the distal condyle, such as lateral condylar fractures, or the proximal joint surface. This is a similar case that recently occurred that was not part of the aforementioned study. This is a side view, and radiographs have been taken of these bones that clearly shows where the fracture was prior to the injury occurring. The bone on the left, which is the right cannon bone, shows a matching fracture to where there was one on the left on the fracture that failed. And again, the yellow circle identifies pre-existing fracture in the bone material. And here is the very same horse making the front page of the newspapers in California when it sustained a fatal catastrophic injury that you've just seen. Here's the same view we've seen before, a little bit closer, showing the fracture and the yellow circle identifying the brown necrotic bone that pre-existed prior to this fatal catastrophic injury. This horse was, the examining veterinarian was concerned with this horse, jogged him a couple of extra times. The horse was on our watch list, warmed up fine, and obviously this didn't end up well. This really gets to the heart of our issue, and that is risk assessment. Whether it's the examining veterinarian, whether it's the trainer, whether it's the attending veterinarian, whether it's the jockey, we do a poor job of risk assessment on these sorts of injuries. We should be able to pick up these earlier than we do. Incidentally, in the fatality review that went along with this horse, the trainer claimed he was totally oblivious that this horse had any injury or any concern at all with his shins. That is in spite of the fact that the examining veterinarian on multiple occasions noted calluses on both shins at different times. I shared this most recent paper with our examining veterinarians and encouraged them when they identify unusual bumps on shins, particularly if there's any evidence of soreness or lameness, to require that those horses be radiographed. And this is an example of a horse that came out of a race, was lame in its shin, palpated sorely. The veterinarian told the trainer that we were going to require a radiograph. When the vet went to work the horse off the vet's list, there wasn't a radiograph, and because the trainer said the horse was absolutely sound. And it was. The examining veterinarian palpated the shin, the horse was fine, jogged fine, but she said, we told you we had to have an x-ray, so we're going to have an x-ray. So here's what the x-ray showed. What this actually shows, where you can, the line is inside the, from the shin, we actually can see an endosteal reaction, but not much of an external callus on this horse, which goes along with the horse not palpating sorely. One thing to remember with stress fractures, those horses can be transitorily lame, but become sound in a very short period of time. We spend a lot of time talking about injuries to horses, but the fact of the matter is that injuries to horses are related to injuries to jockeys. This is a very interesting paper by Peta Hitchens when she was in Dr. Stover's lab at UC Davis in analyzing jockey injuries and correlating them to the necropsy program in California. And what the circle shows here is the fracture we were just talking about. 42% of the time, jockeys are injured. That is, they're taken off their mounts. Some of them have to go to the hospital, and some of them were seriously injured. In fact, I know one jockey who is a quadriplegic from an injury with a metacarpal fracture. The number one cause of jockey injury is catastrophic injury or sudden death of the horse. Jockeys are over 170 times more likely to be injured when riding a horse that dies in a race than otherwise, and about 2/3 of such falls result in injury to the jockey. In California, workman's comp state, we can actually follow the costs of these injuries, and when a horse breaks down in a race, the average claim is over $100,000 per claim. That compares to $20,000 per claim for other causes of jockey falls. For further reading, I suggest you read any of Dr. Hitchens' articles, particularly the bottom two, which were produced in collaboration with Dr. Stover with CHRB California data. And we also have just finished a jockey safety module. Search horse racing injury prevention on Google, and it'll take you to Dr. Stover's Veterinary Orthopedic Research Laboratory. And this module will be available on the Jockey Club Welfare and Safety Summit Advanced Horsemanship website as a CE course, and by the time you see this video. This is data from a very interesting University of Arizona Racetrack Industry Program student project by Christina Moore. Figure 1, the top figure, shows the comparison between actual handle and predicted handle from the logarithm Christina developed, showing very good correlation. Figure 2 shows actual handle versus predicted handle when there was a breakdown. What this shows is that after a breakdown, the handle decreases significantly at a track where the breakdown has occurred. In fact, out of 68 races following a breakdown, only 8 had handle that was higher than the predicted model. And of those 8, 6 were on a holiday race card where the fatality occurred in the first race before the bulk of the attendees arrived. This isn't just a horse issue. This is a racing industry issue. It costs handle, it costs fans. Delmar is a state fairgrounds, and as such, the public has total access. These people are animal rights activists. They came to the CHRB board meeting and bluntly stated that they got rid of the killer whales at SeaWorld and that horse racing is next. As regulators, we pay a lot of attention to integrity issues, and our greatest risk to racing is not a doping scandal. It will be a dead horse and or a dead horse and jockey. If it is the wrong horse at the wrong time, we're not going to get any more mulligans. In closing, I would like all of you to pay attention to the NTRA Safety and Integrity Alliance. This code of standards, this accreditation process is very important to make sure that everything is done as well as it can be done at our racetracks in the U.S. Thank you.